What do you think are the 3 to 5 most critical issues affecting healthcare in Virginia right now?
I'd say health reform, the shortage of healthcare providers, particularly physicians and nurses, as well as payment delivery systems.
What do you mean by payment delivery system?
Well, if you look at the health legislation or the Affordable Care Act, what is mentioned in that act is accountable care organizations, and we're looking at patient-centered medical homes. The way that would look to a patient would be that there would be greater access to care and greater access to higher quality of care. Primarily, the care delivery system is more of a primary care focused delivery system or approach, where you have your primary care provider and other supporting healthcare professionals providing care. You'll have your primary care provider, you have specialists, you might have nutritionists, you might have mental health care providers. They're all centering on the patient to provide a comprehensive menu of services. With accountable care organizations, these are primarily delivery systems that are focused around hospitals and in partnership with physicians.
Is this the concept where providers would be paid more on how well they're doing in serving their patients and their patients meeting their goals rather than how many visits they had with their patients?
Absolutely. The ACO is truly a quality-driven model, and it's a 3-tiered model, with the top tier being the model where one would be a healthcare provider would be reimbursed if they provide the highest quality of care. Through the efficient and quality delivery of services where the patient is involved in the care as well, and the patient is working with the physician or other healthcare provider to reach those quality goals, such as lowered cholesterol, lowered levels of glucose in those with diabetes. It really can become more cost efficient as well.
Now, Governor McDonald appointed you to serve on the Virginia Health Reform Initiative. Is this one of the findings or recommendations coming out of that initiative, to look at different models of care?
The governor put together the Virginia Health Reform Initiative in August of 2010 with 24 members of the community and other stakeholders giving input to all that we're doing with health reform. And in putting together that advisory council, 6 task forces came out of that council. And when we look at that service delivery and payment reform, we're looking very closely at ACOs and patient-centered medical homes.
Are there any other strategies or solutions that have been identified by the Virginia Health Reform Initiative?
My involvement as a senior advisor is with the Capacity Task Force, and the Capacity Task Force is looking at the number as well as the distribution of healthcare providers in Virginia. And indeed, what we're finding is that the distribution of healthcare providers is as big of a problem as the shortage of healthcare providers. One has to understand that we projected that there would be a shortage of healthcare providers on the near term, particularly with physicians and nurses, but when one factors in the Affordable Care Act, there will be a much larger shortage of these and other health care professionals come 2014.
Okay, so the Affordable Care Act being the healthcare reform law,
Right.
Sometimes better known as healthcare reform.
Right.
And you're saying that by 2014 it's going to cause more of a shortage in providers. Can you explain why that would be?
Because the Health Reform Act is primarily something that will expand coverage and provide greater access to care. And at the same time, the idea is to lower costs, to make healthcare more affordable and of a higher quality. So that first piece, expanding coverage, means that more people will come into the system. We see at least 400,000 more folks coming into Virginia's Medicaid system by that time, which can put quite a strain on the health delivery system in Virginia.
Virginia Health Reform Initiative, or VHRI. What are some of the next steps of the initiative?
Well, the initiative right now is looking at health benefit exchanges, and a health benefit exchange is sort of like an insurance marketplace, and it provides an education for the consumer as they choose their insurance. So right now we're looking at governance, structure, and all of that regarding the health benefit exchange. There's certain deadlines in place that have to be met this year and early next year, and decisions made, recommendations to be made, and then presented to the General Assembly at the 2012 session. You can get more information if you go to the VHR website, and the website will provide you with all that's been done thus far, as well as everything that I've mentioned.
Right. At what the Community Foundation does in partnership with Jenkins Foundation and other funders, there's about $10 million going out the door to support different health-related initiatives. This health reform, or the Affordable Care Act, how is that going to impact some of those nonprofit partners that are out there, in the field providing services to uninsured patients right now?
Well, I believe that there's going to be a larger demand for services. Many of those uninsured patients will be eligible for coverage. In fact, the poverty level and eligibility for Medicaid will increase to 133%. And for those of poverty level, and those who are at 133% to 400% of poverty level will be eligible for insurance products obtained through state-run health benefit exchanges. But other nonprofits in particular will be stressed, because those nonprofit clinics that accept Medicaid will see quite a great increase, we feel, in patient demand.
The Community Foundation and the donors that are involved with the Community Foundation and other partners that are involved with the Community Foundation, if they're interested in doing something to help the uninsured or to impact healthcare, it's a pretty complex system. So where does a donor start to look for how they can make the most impact with their donations?
Probably the first place to look is look in their hearts, and pardon me, consider where their passion lies, what organization, what area of healthcare really speaks to them, and donate to those areas.
Do you know other ways that people can get involved aside from just a donation?
Certainly volunteering their time. That's priceless.
Thanks for sharing your wealth of knowledge about the issue, and we look forward to continuing to learn more from you in the future.
Thank you so much. My pleasure.